Thank you very much. Before I deal with today's momentous news with the confirmation that the Pfizer biotech vaccine has been approved, I just want to take an opportunity to congratulate the Northern Ireland women's football team, history makers as they are, and wish them well for the playoffs next year. They really did give everybody a sense of hope last night. And of course that continued this morning, and the news that we've been waiting all year for, yearned for actually, the virus coming under control with a vaccine in a safe and effective way and protecting us from COVID-19. Our task now is to deliver our vaccination programme as soon as possible. It is the breakthrough that we've all been hoping for and praying for, and this is our pathway back to normality, back to a world where we can hug our wider family and friends, able to mark major life events together, both happy and sad, and where we can freely enjoy travel and leisure activities and work and socialise with colleagues. I do want to pay tribute to the medical and scientific communities who have provided this pathway out of the pandemic, and to all of those on the front line who continue to fight a daily battle on our behalf against this deadly virus. This is our pathway out, but we must walk all of that path. Until we reach its end, we must all keep to the public health advice. People can't drop their guard. This is not the end of the fight against COVID. No one is yet protected, and the virus is just as dangerous until you receive the vaccine. The full protection of the vaccines will take well into 2021, and of course this has undoubtedly been one of the most challenging periods of our lifetimes. But we have a common goal, and that is to preserve both lives and livelihoods. We have had to take some difficult decisions in order to protect both, and we said at the start that we will get through this together, and that is as true now as it was 10 months ago. It is this renewal of our spirit of hope that is the most welcome of gifts as we head towards Christmas. We are the first nation across the world to reach this point, and I'm very proud that we will all equally benefit here in Northern Ireland and right across the United Kingdom in this mass vaccination programme. And as we receive this good news in the battle to save lives, we have more good news in the battle to save livelihoods. The Economy Minister, Diane Dodds, will launch a new £10 million scheme for newly self-employed who have been adversely affected by the pandemic. Diane will be providing the full details around eligibility and delivery of this new help, and those eligible will be entitled to an initial grant of £3,500, topped up towards the end of the scheme as appropriate. It's important we do all we can to support all those who have borne the brunt of COVID in so many different ways. And we know that we're not at our end destination yet, but we can now feel confident and optimistic that we will get there. Furthermore, new targeted rapid testing will commence, and this will give thousands of students and their families the assurance of a safe return home for Christmas. There are a number of UK-led programmes underway in education settings across Northern Ireland, and I would encourage all those who are eligible, both students and staff, to take part. With these new opportunities, we must be able to use them all, and there is much hard and difficult work still to do, and that's why we have established that new COVID-19 task force. It will operate at a strategic level and bring together the vaccination programme, the development of new capabilities in rapid testing, and our work on ensuring compliance with the health regulations. This is about ensuring that we maximise the benefits of every advance, get life back to normal, and tackle the harmful legacy of COVID on lives, on communities, and on jobs. Patricia Donnelly, head of the Northern Ireland COVID vaccine programme, and her colleagues have already carried out a substantial amount of work, and they will be able to avail of additional logistics expertise that the task force can provide. And I do want to pay tribute to the vaccination team, of course, under the supervision of Michael McBride. I think they've done some tremendous work, and we've been briefed on that work last week at the Executive. Northern Ireland will receive our 2.85% share of the UK total, and when I spoke with Health Secretary Matt Hancock this morning, he was clear that we would all move together. 16,000 care home residents and their 32,000 staff will be vaccinated in the first phase here, along with our 71,000 health and care staff and those aged 80 years or over, of which there are just over 80,000 in Northern Ireland. The programme will continue in stages, decreasing by ages and clinical risk. Work has been ongoing on the pathway, and when the new 2 weeks of stronger restrictions come to an end, we will see that taking effect. The Executive will discuss this tomorrow. We want to give the public as much advance notice as possible as to how we come out of the current restrictions. Of course, there remains much to do, and I urge every person in Northern Ireland to join with us to get this done. Let us keep on this path now before us and get back to our very much looking forward to getting back to our way of life. Michelle.
Thanks, Arlene, and good afternoon to everyone. This is a good day. It's certainly a day of hope for many, many people. We've all been searching for the light at the end of the tunnel. This has been a very long and winding tunnel where sometimes the light wasn't very evident. But today I think we can see the promise of a brighter future. The power of science and humanity has come together to bring us this breakthrough, to bring us hope and to bring an end to this global health crisis. It is the beginning of the turning point, but we still have a way to go. A vaccination to protect you and your family from COVID-19 will be available, and we should all take some comfort from that. It will take some months to roll out the vaccine to everyone, and I want to assure you that we'll be doing all that we can to make sure that that happens as quickly and as smoothly as possible. There is unity of purpose across the Executive to roll this out and to make this programme a success. Robin will provide some more details in terms of the Department of Health's plan, but we know that it's going to take huge effort, a coordinated effort, which will be supported by the COVID-19 Task Force. I can stand here today with real conviction to tell you that this is not going to last forever and that the end is in sight. Please remember that we now need to work together in the coming months to protect each other, to mind each other, to be responsible. It's only for a short time. The health workers have been at the coalface in fighting this pandemic, and we owe them an enormous debt of gratitude. They have nursed the sick back to health. They've held the hands of many people in their final moments when the family couldn't be there. They have all made huge sacrifices for us. They remain under huge pressure, and we must do everything that we can to protect them. So to them we say thank you. Thank you so much, and I hope that you're heartened today by this news. As a community, we have lost 1,015 people. Each one of those people, a mother, a father, a child, a brother, a sister, a son, a daughter or a friend. And this will be a day of mixed emotions for all of you. And our thoughts are very much with all of those families. A staggering human cost has already been paid in the last 10 months. The pain, isolation and hardship has been felt by many, many people. Our future focus must be to build upon the incredible work that has been done and a determination not to return to the old normality. We have an opportunity for an inclusive recovery. Yes, it is essential that we must protect those who are least well off, those at risk of poverty and those in need. Our recovery goes well beyond that and must look to address exclusion and inequality, much of which has been laid bare for us all as a result of COVID-19. We must create a fairer and more compassionate society for everyone, one which is secure and one which is safe. These are the values, the hope and the optimism that we must carry into a post-pandemic world. We must never forget the pain and the tragedy of 2020. They will have left their mark on many of us. It is that experience, though, that can help lead us to a better and safer future. Thank you. Robin.
Thanks, Michelle. Good afternoon, everyone. And I want to begin by offering my deepest condolences to the friends and families of the 4 people whose COVID-related deaths have been recorded today. We all know this is a deadly virus that has blighted so many lives in so many ways, and the battle against it is far from over. But from now on, the terms of engagement can be altered. Today, thankfully, we can look to the future with some genuine hope in our hearts. We can look forward to a time when the weight of the past year starts to be lifted from our shoulders. So when I joined a 6:30 a.m. call this morning with the other UK health ministers and was informed of the first regulatory approval for a COVID vaccine, I knew then that this was going to be a hugely momentous and significant day. And I want to pay tribute to all those who have worked on vaccine development, not least the scientists and those who volunteered for the trials. I also want to thank those who have been working so hard to prepare for our vaccination programme, and echo the First Minister's comments in thanking our Chief Medical Officer, Dr Michael McBride, and my department's vaccination lead, Patricia Donnelly, and the many staff across trusts and primary care who will be working relentlessly to make it a reality over the coming weeks and months. Vaccines are the most effective way to prevent infectious diseases. They save millions of lives worldwide every day. So today is a good day. Make no mistake about it. But remember, we have many more steps along this long and difficult path to go. Today we announce the receipt of, or will announce the receipt of the first batch of the first vaccine. We hope and expect more good news in coming weeks, with further vaccines being assessed for regulatory approval. It will of course take several months for the vaccination programme to fully roll out and for society to properly reap the benefits from it. Unfortunately, however, there will still be some difficult days to come before then. We are facing a long and deep winter, and the health service and all the staff who work within it will continue to face extreme pressure. While rates of COVID infection have been pushed down, it continues to circulate across and within our communities. Today we reported 416 new COVID cases. That figure is still too high, and that is why the current restrictions and stay-at-home message are so important. We are only 3 weeks from Christmas. How people act today will have a major impact on how many people aren't well enough to sit down for their Christmas dinner this year. The sad reality is that more of our people are still going to lose their lives because of this virus. Our job is to keep that number as low as we possibly can. But it's not just our job, it's our moral duty. There will be difficult decisions to make on what restrictions may be needed in the coming weeks or indeed months. But with better days now in sight, we have a heavy responsibility to keep each other safe. Letting complacency creep in now would be unforgivable. So I would make a direct appeal to everyone today. Stick with us. Keep following all the public health advice to protect yourself and others. This is vital just now, this is not vital just now or in the run-up to Christmas, but for many more months to come. Let's get the maximum benefit from the current lockdown. So please stay at home and help stop COVID spreading. Keep following the regulations and the guidance. And please be patient as we roll out the vaccination programme. It is a mammoth and long-term operation, with everyone requiring 2 doses. I have no doubt there will be challenges along the way. The Pfizer vaccine poses particular logistical difficulties and is likely to be best suited to mass vaccination centres. Forthcoming vaccines should be more suitable for mobile unit deployment, and especially for our care homes, which I know are a key priority for all the UK's health departments. Our rate of progress with vaccination will be heavily dependent on available supplies, distributed as part of a UK-wide operation. We will also have to operate strictly within the conditions set for vaccine deployment by the MHRA, who are the regulator. Likewise, we will be guided by the Joint Committee on Vaccination and Immunisation when it comes to prioritising who receives it first. Most importantly, we will all have to wait our turn and let the priority groups have their place. So patience will be essential, but it will be worth it. Things will get better, slowly but surely. The old year will make way for the new. I have described vaccination as a long walk to recovery. There are many more steps ahead of us, but we now know where we are going. Thank you.
Good evening, Minister, Health Minister, sorry. Can I ask you, Mr. Swann, obviously we've got this vaccine, fantastic news. We have December and January. Big question is, do you think there could be a third wave of this and another lockdown by the time this begins to roll out properly?
Sharon, we shouldn't underestimate the veracity of COVID. And nor should we underestimate the part that we can play in preventing any future waves of COVID. So we are started into a 2-week restricted lockdown, very strict lockdown here in Northern Ireland. So the actions of people today will have an effect directly on where we will be over Christmas. The effect and the actions of people over the Christmas period and the Christmas season will see where we are also in the new year. But we just can't rely on the vaccine, although it is welcome news. As I say, this is the first batch of the first vaccine, so our actions still play a crucial role in where we will be in the new year. If we play our part, if we take our responsibilities seriously enough, we can prevent a third wave in the new year. But it's not inevitable. We all have a part to play in preventing it.
Yes, say if it doesn't go the way you want and transmission rises, will there be that third wave?
Well, look, Sharon, we've always been forthcoming in health. When we see those actions necessary, we bring them forward to the executive, and we have that conversation around the executive table, and we seek the consensus that we need to support the people of Northern Ireland. And it's something that I've been welcome for. We have seen that support through and to my health department in regards to how we combat COVID.
Sharon, just to add, I think there's no certainty in a pandemic. And that's the reality in which we've all had to deal with. We've had to deal with over the course of the last 10 months. We've tried to be as clear with people as we move our way through this, but it's been an ever-changing situation, and unfortunately there hasn't been certainty that people obviously crave. But there's certainty in a vaccine, but we obviously have a journey to walk until we get to the point where everybody is vaccinated. Can't hear you.
Mary-Louise?
You really would think I'd know this by now. It's Mary-Louise, BBC. Can we take a look at those groups who are exempt? I've received a few texts from people today. For instance, if you are pregnant and work in one of our health trusts or in a care home, a healthcare worker, what will the advice be for those women?
Mary-Louise, maybe I can pick it up. There's no one exempt because this is not a compulsory vaccine. So there are still recommendations coming through from JVCI and MRHA. Women who are currently pregnant or become pregnant during the cycle of the vaccine are advised not to take it because we still do not have the scientific evidence for that specific group of individuals. So that is the guidance that will come out through MRHA and JVCI.
And just another question. I need further clarity around care homes. It was described to us this morning at the Ulster Hospital that healthcare workers, vaccinators will be vaccinated first at the Royal, hopefully next week, and then care home staff. Will they be taken before the likes of nurses who work in hospitals, or how soon are we likely to see care home residents receiving this vaccine?
Mary-Louise, we want to get vaccines to care homes as quickly as possible. That's a priority for us. It's a priority for JVCI. So too are care home staff. And the JCVI have made care homes a priority, but they have also acknowledged there will have to be some flexibility in the deployment, given the requirements and the characteristics actually of this particular vaccine. So we will also have to operate strictly within the conditions set for the use of this vaccine through its deployment by MHRA. As we've discussed, and as I think you've highlighted yourself, the Pfizer vaccine poses particular logistical difficulties and is likely to be best suited and is best suited to mass vaccination centres. So forthcoming vaccines rather than the Pfizer one should be more suitable for those mobile unit deployments, especially for our care homes, which I know are a key priority for us as an executive, but also for the UK health departments when it comes to that piece of work. So we will get vaccines out to care homes as quickly as we feasibly can. And care home staff, as you've mentioned, will get the vaccine at a vaccination centre along with health and care employees. So that piece of work and information will already be worked through by the trusts.
Hi, good afternoon. It's Michael from PA. It's a question for the Health Minister, please. Roughly what proportion of the population will need to be vaccinated before all restrictions can be lifted?
Michael, I don't think we have set an exact figure on the level of vaccination or immunity that will be necessary before we can see the lifting of all restrictions. There is some scientific papers in regards to what is necessary for the wider immunity to actually have any effect, and vaccine take-up would be indicated around 70%. So that is it is a high level. But what we see in Northern Ireland, even in regards to our flu vaccination programmes, is that we already have a population who are engaged, and those more clinical in need groups actually have come forward in great numbers for the flu vaccine. So we would hope to see that replicated when the COVID vaccine does become available, as it does work its way down and cascade its way through those groups who will be eligible.
Thank you. And this is just a question for the First Minister or the Deputy First Minister. When do you expect the COVID guidance on arrangements after December 11 to be published?
Well, we're having an executive meeting tomorrow, Michael, and we want to be able to communicate to people well in advance of at the end of this lockdown period, so next week, the 11th. So we hope to be able to get an executive decision tomorrow, have that communicated immediately, and then move to place the regulations directly afterwards.
Hello, Minister. Just Vincent Kearney from RTE here. This is really to whoever is best suited to answer the first question. There are many people, many hundreds of healthcare workers in Northern Ireland who live across the border in the Republic and cross the border each day to work. Will they be able to avail of this Northern Ireland vaccination programme, given that they work here, or must they be resident in Northern Ireland to avail of this programme?
Vincent, we will support our healthcare workers as they come forward and meet the need of the accessibility of this vaccine.
So just to clarify, so that means no matter where they live, if they live across the border, they will vaccinate?
If they meet the priority groups and are currently employed within our healthcare service and work in it, they will be eligible for that vaccine.
Sorry, Minister, my original supplementary was, in terms of that cross-border dynamic, any plans for cross-border cooperation on the rollout of a vaccination programme? Is there a need for such cooperation?
Vincent, I've never been found wanting in working across cross-borders, either north-south or east-west. Our vaccination programme, as I've said many times, we're part of the UK's pre-buying of 7 particular vaccines. That's why we've been able to bring this one online so early. It also received the accreditation and validation from the MRHA. I'm aware that the European Medicines Directive, our agency, are still looking at this particular vaccine as to when they come forward with the regulatory approval that we received this morning. So the potential of joint clinics or joint vaccination centres isn't something that's on the table at the minute, because the vaccine is only available currently in the United Kingdom and Northern Ireland. We're the first country across Europe actually to move at this step.
Today's a landmark day, Vincent, and I think that there are opportunities for us to have conversations on an all-island basis at the North-South Ministerial Council meeting that will happen in the next number of weeks. I think it's really, really important that, again, as we have done throughout the pandemic, where we can work together, we should be working together, and the virus has moved very freely right across the island. It doesn't stop any jurisdictional boundaries. So I think that in terms of the vaccination programme, the more aligned we can be, then clearly that's the space that we also should be in.
Good afternoon, Ministers. Tara McLaughlin, Downtown Radio, Kill FM. I just want to put a question to the Health Minister. First of all, just picking up on these priority groups, and the JCVI actually have care home residents at the very top of the priority groups, but could you clarify, or could we be in a situation where they may actually have to wait until the next vaccine is available because of the way this has to be stored and because of the conditions that it has to be stored under?
No, I think, Tara, in answer to a previous question as well, when you look further down and actually what JCVI have said, although they've said that the care home should be a priority, they have also acknowledged that there will have to be some flexibility in deployment in regards to the requirements and characteristics of any particular vaccine. And we do know that this Pfizer vaccine comes in batches of just under 1,000. It has to be then further distilled before it can actually be administered. That has to be done in aseptic conditions under the supervision of a pharmacist. So it does not lend itself easily for utilisation in care homes. So although the criteria have been set, we also have to make sure that the characteristics of the vaccine meet the need and the ability to deploy it in certain settings.
And we're hoping, Tara, that I think the Health Minister will confirm that the AstraZeneca vaccine will be given the validation quite soon. So hopefully there will not be a gap between care home residents and indeed care home staff receiving the vaccine. Obviously, we have always put care home residents at the top of our concern. We know they're our most vulnerable and indeed most precious citizens, so we want to make sure that they get the vaccine as soon as they possibly can, but within the limits, as the Health Minister says, of the first vaccine, which has to be kept at, first of all, such a low temperature, and the fact that it comes in such a large batch as well.
Thank you. And a question for the First and Deputy First Ministers in terms of the restrictions and any future lockdowns, because we know that we may not be able to have a mass vaccination programme, or this may not be available to the wider public until perhaps April time, so we may be facing more restrictions. The last time when close contact services were closed for this individual week, were open for 1 week before they were allowed to, they had to close again. There seemed to be a prevailing opinion that they understood why you had to make the decision, and they understood that there had to be a lockdown, but there was frustration at the decision-making process and the lack of notice. Do you accept that maybe that isn't ideal, and will you strive to give people more notice in future?
Well, I think on occasions throughout this pandemic things have not been ideal, and we fully accept that that has been the case. What we are hoping to do tomorrow is to have that full discussion about the ending of the current 2-week restrictions, which happens the following Thursday evening, so that we can be clear with all of the businesses that are currently closed. We know that there are many of them waiting to hear, can they open again on the 11th, and we want to give them that clarity on how can they open and what mitigations do they need to put in place, what is the guidance. So we'll work through all of that tomorrow. Our hope and our desire is that we will be able to say more about that tomorrow. Okay.